I do want to ask Karen, again, from the LLS, about some of the resources, for patients and caregivers to better understand what a diagnosis is and what it brings. So Karen?
Sure. I think first and foremost, we always encourage everyone to call our Information Resource Center. That's our call center, as people will often refer to it. It is staffed with social workers, nurses, health educators that are highly trained oncology specialists, and they are there to answer questions about the disease, about treatments, um, anything that relates to now being diagnosed with a blood cancer, and specifically here with a lymphoma. I think it's very important to be able to talk to someone who can give them all of that information. And as you can see here, there's a list of resources that we have available. And, they can direct the patient or the caregiver in the right direction to get whatever they need. Some people learn better by speaking to someone, but then if they would like a booklet on lymphoma, or if they want to watch a webinar, or listen to a podcast, or attend an actual program, I think that they should take advantage of whatever information is out there. Here you can see just a graphic of some of the things that we provide. But it's always best to start with one of our specialists, because then they can make sure you're getting the right information for the questions that you have at that time.
Thank you for sharing that. And Karen, I know you've been doing this for almost 25 years at the LLS. What have you found patients and caregivers really, seek information about at that stage?
So with lymphoma, it usually starts with what kind of lymphoma they have. They're not always sure. They kind of think it all gets lumped together, right? So it's having that conversation to say, okay, well, exactly what lymphoma it is, and then to talk about the types of treatment, right? And make sure that they're asking their physician the right questions, getting the information that they need. And then from there, to be honest with you, a lot of times it goes in the direction of financial resources or what other supports there are out there. And I know we're going to talk about some of that later, but that's really the direction it will normally take.
Thanks for sharing that perspective. I thought it was, it's great to talk to someone who, again, has so much experience with patients and caregivers. Mags, we're going to go now into questions to ask, or things that you can do as a patient and as a caregiver to make it easier, right? Like, we've learned through the process some things. So one thing I learned was, when I'm in the appointment with the doctor, a lot of times, especially the first time around, and especially in the beginning when it's super overwhelming, I'm like, I don't remember anything you just said, right? Maybe they covered a lot, but I just don't remember. So someone else told me, hey, I bring in my phone and I ask the doctor, can I record you, just so that I can replay it later. And that way you can share with other people. But I'm going to pull up one of your quotes from a story where you talked about having another set of eyes and ears in the room. So what can you tell people in terms of what helped you?
Absolutely. So I, at the beginning, especially brought my boyfriend with me. He's just like, he knows me better than anyone else. And he was just another set of ears. He would catch the things that I wouldn't catch because I just felt overwhelmed, because when it's talking about you and your problems, you feel overwhelmed. There's lots going on inside your head. So you're not exactly absorbing everything the doctor's telling you. So I bring him. He would also ask questions that I probably didn't think of. And so I think it's important, if you do want to bring someone, that it's someone that you trust, someone that has your best interest at heart, someone who is going to be there to support you and also kind of be there to help you make decisions when you do need to. I would also take notes on my phone. I did record once. So just make sure you always ask your doctor if that's okay. I would take notes on my phone, or already come with questions already ready to go to ask. And when it came to like any sort of like papers or scans, I would just always ask for a copy of them so I could take it home and review it later on, kind of when I had already digested and processed everything.
Yeah, I feel like one of the common themes is sort of, again, it's hard to take in all this information, especially when you're in the beginning stages and you're getting the tests done, right? Like the scans, the blood tests, maybe you have a bone marrow biopsy, and everyone's trying to figure out what exactly you're dealing with, as Dr. Miklos was, describing non-Hodgkin lymphoma. I mean, it's dozens of different kinds of things, right? It's dozens of subtypes, B cell, T cell, and everything else. So thanks for that, Mags.